name is Bruce Slane. In this video, we're going to discuss what happened to Candace Owens. For many years, she's done many podcasts on vaccinations, stating that she's fully against them. So, what happened to her? What is her story? I think that it's fascinating. I think everyone should know what happened to her. I think she should have a full understanding of what happened to her and what set her off on this journey. Before we do that, I just want to say I think she's very smart. There are many things that I disagree with when she talks about vaccinations, and there are some things that I might agree with what she's saying in relation to vaccinations. I believe that her healthcare professionals failed her in relation to her treatment regarding vaccinations and failed her in explaining what vaccinations are and are for. Now, who am I? My name is Bruce Slane. I'm a medical malpractice attorney in New York. I practice vaccine injury litigation in the Federal Court of Claims. I represent mesothelioma victims and their families. I'm one of the longest living survivors of mesothelioma. This is not medical or legal advice. I have not reviewed any of Candace Owens' medical records, I did not speak with her doctors. I did not speak with Candace Owens. It's my opinion based on viewing her podcasts. So essentially, it's speculation, but I'm basing it on what the medical literature shows in relation to events that she describes. Now, let's go through what happens here. Let's hear what she has to say about her story.
So, anyways, I rolled up my sleeve to get the first shot, and immediately after he administered it, I hit the ground and I passed out, which I never pass out. I am not a person that faints. I am not a person that is queasy. So this was very out of the norm for me personally. And when I came to, what he essentially said to me was, "Did you eat breakfast this morning?" And I said, "Well, no, I didn't eat breakfast." He said, "Well, that's why you passed out. It's okay, not a big deal, but you should make sure before you get the second shot that you eat breakfast."
So I think what the OBGYN or the nurse or whoever is speaking to her, what they said to her, I think that's outrageous. It's ridiculous. Why didn't she pass out 20 minutes before the vaccination? Why didn't she pass out an hour before the vaccination? So, this doctor's office, they're not used to seeing something like this. It's my opinion what happened is something called vasovagal syncope. And a family medical physician who gives out lots of vaccinations and draws blood, they'll see this. They'll see patients sometimes pass out. Usually the patient is susceptible to it. It is something that what happens is anxiety or psychosomatic response stimulates the vagus nerve, which causes a drop in blood pressure, which causes the fainting. So, if that vaccination syringe, if that was saline solution, she still would have passed out. It's something that it's a physiological response, but it's a response to stress and anxiety. Syncope can also occur during a bowel movement. Now, this wasn't explained to her. It should have been noted in the chart when she passed out, telling her that it's from not eating. It's obvious it's not true. So they didn't put it in the chart. They didn't explain it to her properly, and that's a nightmare. That's something that could cause further injury. Let's go through what she further says about the next time she receives a vaccination.
So I was a little spooked. They sat me down, gave me some water. I left thereafter, but he had given me what I assumed was a valid reason for this happening. I obviously hadn't eaten breakfast that morning. Went back to get my second shot and made sure that I ate breakfast that morning. And when I sat down, I just thought there was no plausibility that I was going to pass out. The nurse came in, she gave me the injection, and this time my reaction was much more severe. Not only did I pass out, and I remember this moment especially horrifically because she had asked me to disrobe because afterwards I was going to have an exam. So I was essentially just wearing a shirt and one of those little pieces of paper, to cover your parts. And I had passed out, fallen off of the chair or the table rather that I was on. And when I came to, I began having what can only be described as a mini seizure. I began shaking and I began vomiting profusely.
Now, that's horrible that this happened to her. It should have been noted in the chart that she was susceptible to vasovagal syncope. Now, is she having a seizure? Well, that's something different. She still drives a car. When you have a seizure, that's something that just doesn't just go away. Usually, you're having a seizure disorder. You have continued seizure. You're on anti seizure medication. Did she get checked out by a neurologist and get cleared for that issue? But it's horrible what happened when she passed out. She's passing out from a table. She could have hit her head. She could have got severely injured in that manner. What happens is your body releases adrenaline to raise the blood pressure and to wake you up. And here she has this full stomach of food with adrenaline just flowing into her system like she just ran a quarter mile. Of course, you're going to throw up. And with all this adrenaline in your system, you're going to be shaking. So that's unfortunate that the medical office handled it in that manner. She could have been permanently injured from that fall. Thank goodness she wasn't. Now, the contents of that vaccination, that could have been saline solution. She still would have fainted. It's the psychosomatic response that stimulates the vagus nerve, which causes the drop in blood pressure. Let's listen to how she further describes what happened to her.
I didn't feel like myself for years after getting that second installment of the Gardasil shot. I had a fatigue that I can't even describe to you that lasted for years. I felt like my brain didn't work the same since getting that vaccine. I know that I have shared the story before and so many women have written into me. This really seems to be the one vaccine that so many women have had reaction to.
That's fascinating that she describes it in that manner. Vaccinations like the flu vaccination, for example, can cause something that's called Guillain-Barré syndrome, and that can cause nerve damage throughout your entire body. And nerve damage can cause fatigue because of the blood flow issues with what the nerve damage sets off and orthostatic issues. Candace Owens does not have Guillain-Barré syndrome. Did she go for a lumbar puncture to check her protein levels? Did she go for IVIG treatment to treat this condition? This is something that's likely psychosomatic. When you have fatigue from an autoimmune condition, there's a chance that the nerves can regrow over a 6 month period. But essentially, you have that for the rest of your life. You're in treatment for it. It doesn't go away. So Candace Owens doesn't have Guillain-Barré syndrome or nerve damage relative to this. It's something that she's likely not sleeping. Maybe she hit her head when she fell, and that's causing some issues. But it's vaccinations can cause an autoimmune response and autoimmune injuries. What happens is there's a latency period. You get the vaccination, and the symptoms kick in anywhere from 3 to 42 days. Usually it's 2 or 3 weeks later. So you're absolutely fine for 2 to 3 weeks. And then all of a sudden you can't walk. If, for example, if you get something like Guillain-Barré and you're in the hospital and you're in death's door. I have clients in wheelchairs with Guillain-Barré. She does not have Guillain-Barré syndrome. She does not have nerve damage relative to this, based on how she is today. She's functioning very well. She's not complaining about paresthesia or numbness in her hands or feet or things to that nature. Vaccinations can also cause allergic reactions. So if she was not breathing after the vaccination and holding her throat and then passed out because she's unable to breathe, well, that's something else. Now, how do you do research to figure out what happened to you? When people would experiencing something like this, what is the normal course of action? Well, you fainted, you think you had a seizure, get evaluated by a neurologist. Get cleared so you can drive a car. So you're safe to drive a car. You could be walking in a supermarket. You don't want to fall down and crack your head because of this this fainting all of a sudden. So it's dangerous in that respect, but also if she thinks it's immunological, go to immunologist. Get cleared by an immunologist. There are also immunologists that are double board certified in allergy and immunology. So they could check the allergy component of it or the immunology component of it. Did she do these things? Well, she dove into the literature, but if she dove into literature, she would have seen vasovagal syncope. And it's dangerous because she could go and think that go to have blood taken in the future, and then right afterwards she could jump in her car, and then all of a sudden you could be walking across the street with your children and her car, she could just pass out and hit your whole family. Why? Because syncope can happen up to 15 minutes after an event of a vaccination or blood being drawn. And that's because when the vagus nerve is stimulating, sometimes the adrenaline pumps in and keeps you awake. And then all of a sudden the body starts reducing its adrenaline, but the vagus nerve is still stimulated, causing the drop in blood pressure. So there are people that faint up to 15 minutes after the event, after the vaccination. In fact, there are some famous cases, people jumping in the car, getting to bad car accidents after vaccinations because they had a syncope, vasovagal syncope. So it's horrible that this happened to her, but it's something that she went down this path and she did not do the research on this. In 1997, I was diagnosed with mesothelioma and my right lung was surgically removed. This was attributed to asbestos exposure. Today, I'm an attorney and I fight for the rights of injured victims. My name is Bruce Slane, and if you or a loved one was recently diagnosed with mesothelioma, call me. I'd like to speak with you. Let's further hear what she has to say about the Gardasil vaccination. Before we do that, just to further address the syncope issue, there's a way that she could figure out whether she's prone to vasovagal syncope through vaccinations. She could go to the doctor's office and have them say that, okay, Candace, we're just going to put saline solution in a syringe and then come back a week and then we'll go through a mock vaccination with you, okay? And then she can come back in. They go, oh, Candace, we're giving you your third Gardasil vaccination. Your arm's going to be sore. Do you have any questions? Okay, here we go. And most likely she's gonna hit the ground. I put a camera up. You could watch. You could probably be very upset at the incident. And the one thing, if she doesn't pass out, one of the things we're preventing is like if she would to keep on telling herself, "Oh, it's only saline solution. It's only saline solution. It's only water." It's not the contents of the vaccination that causes the fainting in these instances. Let's hear what she further has to say regarding the Gardasil vaccination.
So let's fact check how successful the Gardasil shot was for females. So these numbers are from 2022. In 2022, there were 167.5 million females living in the United States. Okay. Of the 167.5 million females living in the United States, there were 14,100 cases of cervical cancer. Now, the math on that means that if you were in a female in the United States, and this is after almost 20 years of having, almost 2 decades of having this wonderful vaccine to prevent from cervical cancer, your chances of getting cervical cancer today are 0.0084%. That's weird because that means that cervical cancer rates have gone slightly up in the United States since the rollout of the Gardasil vaccine.
Now, if she did the research, she would have saw that it takes 20 years for cervical cancer to develop after HPV. Now, if they're rolling out the vaccine in 2006, you're not going to see a reduction in cancer rates for at least 20 years. Maybe a little bit sooner, but it's going to take approximately 20 years. Now, she's reading cancer rates before that point. Now, what is the cancer rates of 2025? That's almost 20 years. Well, it's now 13,360 cases in 2025 with 170 million women. So it's down. Now, in the next 5 years is when we're going to see the reduction. If that's what happens, we're going to see a reduction in cervical cancer rates, and time will tell the effectiveness of that vaccination. She should know why she's took the vaccination to begin with. She should have that understanding. If she's getting a vaccination and thinking it's going to prevent her from getting cervical cancer in the next 5 years, she's obviously wrong. It's protecting against HPV, because HPV can cause cervical cancer over the course of 20 years, sometimes 15 years, usually 20, 30 years. On a separate note, I was visiting my wife's aunt, and she's elderly, and she had a caregiver with her, and the caregiver was sick. I'm like, wow, this should probably need a caregiver for the caregiver. And I was speaking with one of her relatives who was saying, oh, it's so sad. The caregiver has cancer, very late stages. She's stopped all of her treatments, and she's going to live out the rest of her life. She's in pain. And I asked her, what type of cancer is she suffering from? And she said cervical cancer. It's very sad. She's in her 60s. The individual that's suffering from it, and they didn't have the vaccination years ago. So this can save lives, and the next 5 years is going to show what what rate did it reduce by that vaccination rollout. Let's further hear what she has to say.
And this vaccine is a vaccine against HPV, a sexually transmitted disease. So I'm going to ask you to explain to me why children in daycare would be taking a vaccine against HPV, which is a sexually transmitted disease.
They're giving Gardasil vaccinations to 12-year-olds essentially now. And they're doing that because when you're 12 years old, you develop 3 times as much antigens to a vaccination than you do when you're 19. So that they only have to give 2 vaccinations. Instead, if you wait to 19, they're giving 3 vaccinations. So if you're not thrilled about vaccinations, less vaccinations is better. But more so, when you're giving it to a 12-year-old, they're not going to be sexually active. Once an individual is sexually active and they're already exposed to HPV, the vaccination could be pointless because they already have the HPV. That's the reason why they're giving it to children essentially. Let's continue what she has to say.
According to the CDC's website, for HPV, the sexually transmitted disease, which I had never heard of until they suddenly wanted me to take the Gardasil shot. We didn't learn about HPV in school at the time that I was in school until the Gardasil shot. Then we all started hearing about it. Well, for 90% of individuals, HPV clears up without any treatment at all.
Well, if you're going to be sexually active, you should know what HPV is. If you're going to have a Gardasil vaccination, you should know what HPV is. You don't want to have HPV. There are women who have their cervixes removed because of HPV, and they don't even have cervical cancer. It's not something that you want to have. I have women calling on the phone saying they want to sue, and not so often, but it's calling saying they want to sue their boyfriend because their boyfriend gave them HPV. And I explained to them, well, there's when you bring a lawsuit, there's issues with the litigation. This is not the type of case that you want to bring a lawsuit on. And I'm sitting there listening to the horrors that they're going through because of their HPV. When this vaccination came out, the OBGYNs who see this 100 times more than I would ever see, 1,000 more times, they look at this and say, "Oh my goodness, this is the answer to the horrors that they're seeing relating to women coming in with HPV." and that's why they're promoting the vaccination. So I really think that Candace Owens should have an understanding what HPV is and what the vaccination is and what it does. And I think that's important. And thank you for joining me on this video. Hit like and subscribe. I'll see you on the next video.